Cognitive Theory, Understanding Meaning and Experience by Kizzy Nieves, Christine Pagano, Thomas Shea, and Ashley Tatum. Cognitive theory exploded in popularity during the cognitive revolution in the late 1950s as a response to the dominant psychological theory of behaviorism. Earlier psychodynamic theory identified internal unconscious forces as the cause of behavior. Behavioralism identified the environment as the behavioral motivator to explain how our actions are impacted by what happens immediately before and after a behavior occurs. In behaviorism, the environment motivates the behavior. This can also explain why behaviors increase and decrease. As a phenomenon, behavioralists did not reject cognition, and some, like Skinner, focused on the internal mechanisms that produce behavior. However, the process of thinking and learning from actions were viewed by behavioralists as only extensions of behavior. According to Bandura, these early theories are simplistic because they favor a unidirectional causation and fail to consider the effect of cognition, the mental process of assigning meaning and significance to experience. Cognitive theory, building upon these theories, concludes that our thoughts, those both related and unrelated to behavior, and not just consequences, influence behavior. This is referred to as higher-ordered thinking. In conclusion, cognitive theory suggests that our behavior is motivated by our conscious cognitions, unconscious cognition, and interaction with our environment. Cognitive theory views behavior as one. Practice techniques can include psychoeducation, which is teaching and giving the client and their families information about their condition and schema for treatment, self-monitoring, empowering clients to track progress using biological, emotional, cognitive, or environmental data. Cognitive restructuring uses thoughts techniques such as splitting, magical thinking, and emotional reasoning to confront cognitive distortions. Rational analysis, a systematic cognitive process by which an individual learns to ask better questions of themselves. And performance attainment, an experimental process by which the individual can test new performance-based schema. Cognitive theory includes collaboration and according to Langer and Leitz, cognitive theories can work across several settings. These settings vary and include individual and group therapy, hospitals, group homes, substance abuse centers, hospice care, educational institutions, justice systems, and psychoeducational groups. Within these settings, the application of cognitive theory may vary as well, but it is important to remember that cognitive theory intervention focuses on thoughts, feelings, and behavior and the interpretation of experiences or perspective. Cognitive theory has also proven effective in the treatment of anxiety disorders, phobias, anger management, mood disorders, eating disorders, personality disorders, substance abuse, couples therapy, trauma, and insomnia. Cognitive theories can work across several settings. These settings vary and include individual and group therapy, hospitals, group homes, substance abuse centers, hospice care, educational institutions, justice systems, and psychoeducational groups. Within these settings, the application of cognitive theory may vary as well, but it's important to remember that cognitive theory intervention focuses on thoughts, feelings, and behaviors and the interpretation of experiences or perspective. Cognitive theory has also proven effective in the treatment of anxiety disorders, phobias, anger management, mood disorders, eating disorders, personality disorders, substance abuse, couples therapy, trauma, and insomnia. In various settings, the strategies used by the social worker will vary as well. In all settings, it's imperative that the social worker create a sense of belongingness and acceptance by validating the client's emotions, thoughts, and experiences. It is also crucial to establish guidelines and boundaries. This improves individual and group safety. Socratic questioning is another strategy in which the social worker feigns ignorance to evoke the client's knowledge or belief about an issue. Once the client discusses their perspective, the social worker can correct any misinterpretations and guide the client into a more realistic thought process. Another strategy is affective education or mindfulness. In this, the client is taught to become aware of their emotions and then guided by the social worker to identify maladaptive behaviors, which then can be addressed. Meditation can also be helpful in assisting clients to learn how to stay focused on internal feelings and thoughts by blocking external stimuli. A social worker can also introduce role-playing and modeling, which are forms of practice to assist clients in learning how to cope with emotions and challenge their thoughts through simulated real-life experiences. Cognitive theory works well with diverse client systems. People of various ages, cultures, and systems respond well when cognitive theory is used correctly and competently. When working with a diverse client system, the social worker will engage fully with the client, group, or system to first build a relationship. Only then can the social worker begin to empower the client by understanding the client's concern through the client's perspective. Competent social workers adapt their approach to be age and developmentally appropriate. It is pertinent that the social worker does not attempt to use the same cognitive approach across all client systems. Competent social workers understand that each client system is different from another. Social workers are to adapt to different approaches when meeting new clients. They do this through shaping, which is trying various approaches to allow groups to respond comfortably. One of the primary strengths of cognitive theory is that it is well developed and strengths or skills based. The concepts and underlying principles are clear and quick to learn, resulting in easy application for many social workers. Cognitive theory is known for having practical applications and is easily combined with other approaches. Cognitive theory is known for being scientifically based and very cost-effective for clients. One limitation of cognitive theory is that it tends to focus on individual functioning and pay little attention to macrosystem influences. Cognitive theory is focused on the individual and the closest systems, making it less helpful for those working on a macro level. Cognitive theory also does not consider nature versus nurture or social and cultural factors and portrays that the mind is like a machine, and we know that this is not always the case. Another limitation of this theory is that it has the possibility of giving social workers too much authority as the method seeks to change thoughts, allowing the opportunity for the irresponsible use of the theory to replicate the experiences of colonization. This issue can be addressed through integration. When using cognitive theory, it is essential that the social workers understand the potential risk of using cognitive interventions in a way that imposes values inconsistent with those of the client or client system. This is especially true regarding marginalized people. Thank you for viewing our media presentation.